Hi guys, I've been asked to do this over the last 2 years and I've only just managed to do it now. It's been not easy to talk about. In the 1st of July 2014, I lost a very close member of my family, part of the heart of the family, Tom, through terminal cancer. But it wasn't as simple as just having terminal cancer, as the lies and the deceit that was done before his actual death. To cut a long story short, Tom is in and out of hospital continuously with UTIs, which is a tract infection in the urine, which one is bad enough to have so many and being treated on antibiotics for so much would set alarm bells going, but certainly didn't for the consultants of this hospital, who I can't name for legal reasons. The couple of stages that he did go into hospital, also he had septicemia, which is poison in the blood system. Again, put on drips and antibiotics and sent home with a sick pill. So the very last, when he was brought in, again with septicemia, and he was put on a drip and he was put on to antibiotics. And this time the family wasn't taking any nonsense, so we called upon the consultants and the nurses in question that were looking after him and asked the question, does Tom have cancer? And taking into consideration that Tom had lost a power of weight and his energy levels had literally gone. And we were told by this consultant, absolutely not. Tom doesn't have cancer whatsoever. Tom's just frail and he has a UTI. And he was being released with a sick pill. We went to pick him up and I looked at a dead man, basically, and I wasn't happy. So I asked upon the consultant again and told her of my concerns. Again, she said, no, we needed the bed and he was frail, but he was fine. So we came home. We had 11 days with him at the house where he wasn't eating, he was losing more weight, he was crying out in pain, and continuously going like that throughout 24 hours a day. And, well, basically we had enough. So consulted with Tom and brought him back to unfortunately the same hospital. And this time it was adamant that we were not going to let Tom get released again with a sick pill. We wanted the right tests done, continuously done properly. And eventually we got one particular consultant who actually had intelligence and did the test, and 2 hours later I was brought in to be told that Tom had terminal cancer. He had 2 weeks to live. Now, from 11 days prior to that, when he was released and we were told there was nothing wrong with him except for a UTI, to be told then 11 days later that he had 2 weeks to live makes me sick. It makes me disgusted that consultants can get away with not doing the proper diagnosis and prognosis and lying to family and patients. And then eventually you get one consultant who has the intelligence to tell you the truth and do the actual exam and the actual CT scan, which could have saved Tom's life 68 months prior to that, which they didn't do. So I'm sending this out just so that it's live, to let you know that unfortunately the hospital lied to a family and also lied to the patient, Tom Duncan, because if they hadn't we would have possibly had more time or a lot more chance of treatment. So thanks to that hospital. But when we called upon a meeting after he died, it was very interesting to sit and listen to each and every one of them cover each other's backs and throw little threats in to say they have good lawyers if we took it further. So they took a lot from the family's life, and unfortunately my mother has dementia now too, with the stress and the worry of watching Tom, in that last year. So thanks to that hospital for doing what they've done, but I will rest assured that the consultants and questions don't do that again. Thank you.